When a burn or deep ulcer is left exposed, the wound bed becomes an immediate target. Microscopic pathogens can rapidly multiply across the vulnerable tissue, escalating the severity of the injury. To intercept this threat, we use Sulphachlor-Tulle, manufactured by Cottoncraft Private Limited. This acts as the primary defense layer for treating first, second, and third-degree burns, as well as severe abrasions. In this walkthrough, we will cover the precise application method required to establish this antimicrobial defense, along with the strict storage protocols you must follow to keep the product fully potent. Before we begin, gather your supplies. You will need clean examination gloves, a sterile saline cleanser, the Sulphachlor-Tulle dressing itself, and a secondary gauze pad. Mastering both how you apply the dressing and how you store the box guarantees your patient receives uninterrupted protection during the healing process. Step 1 is preparation. Put on your clean examination gloves and carefully assess the severity of the wound bed. Next, gently irrigate the affected area using your sterile saline. The goal here is to flush away any loose physical debris without aggravating the underlying tissue. Once clear, take a clean pad and pat the surrounding healthy, intact skin completely dry. Do not wipe or scrub the area. Establishing this clean, dry perimeter is structurally necessary. We must create a neutralized, debris-free baseline before introducing any active medicated layers into the wound cavity. Now, open the sterile packaging. Depending on the size of the injury, you will either use a pre-cut 10 by 10 centimeter square or cut the exact length you need from the 15 by 150 centimeter roll. Take the medicated paraffin gauze, also known as Tulle gras, and lay it directly and evenly over the exposed wound bed. As the gauze makes contact, the patient will experience a distinct cooling sensation. This formulation actively works to soothe localized discomfort. The dressing Silver Sulphadiazine immediately releases silver ions down into the wound. These broad-spectrum antimicrobial agents seek out and neutralize gram-positive and gram-negative bacteria within the tissue. They specifically target stubborn pathogens like Pseudomonas aeruginosa, clearing persistent bioburdens to treat severe burns. While applying the mesh, carefully trace the borders of the injury. Avoid overlocking the medicated dressing too far onto the surrounding healthy, intact skin unnecessarily. The Tulle gras functions as an active biological shield, providing a physical barrier that simultaneously neutralizes microscopic threats through its sustained silver release. With the primary layer in place, take your secondary sterile gauze pad. Place it directly over the Sulphachlor-Tulle and secure the edges firmly with medical tape. This absorbent outer layer is strictly required. It works to manage and capture any excess wound exudate as it's drawn up through the paraffin mesh. Together, this two-layer system successfully locks in the moist environment critical for cellular repair while keeping external physical contaminants entirely locked out. With the application complete, we need to address the remaining unused rolls and unopened boxes. Looking at this storage diagram, note the strict environmental limits. The product must be kept in a cool, dry place, strictly below 25 degrees Celsius. Additionally, you must keep the storage area completely free from direct light exposure. When exposed to light and excess heat, an immediate chemical failure occurs. The silver components rapidly degrade, darkening and losing their structural integrity. Poor storage directly strips the dressing of its infection-fighting power, turning a vital, active medical asset into useless, inert mesh. Fast forward to your eventual dressing change protocol. Start by carefully removing the medical tape and lifting away the outer, secondary bandage. This leaves the primary paraffin-impregnated layer resting on the wound. Because of the paraffin base, this medicated layer is highly non-adherent. As shown in this cross-section diagram, standard dry gauze can easily embed into healing tissue. Sulphachlor-Tulle, however, will cleanly lift away. It separates from the wound bed without sticking to or tearing the fragile new skin tissue. If the outer secondary layers snag, never forcefully rip the entire assembly off. Let the non-adherent primary layer perform its natural, painless release. As you continue care, consistently consult a healthcare professional for specific medical advice regarding the ongoing wound healing progress. properly applied, Sulphachlor-Tulle secures aggressive infection prophylaxis during the long healing process, while ensuring protective, painless comfort for the patient during their recovery.